Hello, this is Dr. Tariq. So let me go through some clinical application for digital dentistry. This patient, she came to our office and she's complaining about two things. She's complaining about her old restoration. So she's not happy with the final result of her restoration. First, second, she's complaining as well about her gummy smile. So, and to be able to communicate with your patient, you have two options. Either you will get an impression, send it to your lab, and you will wait for a couple of days till you get your WhatsApp back to your office. Then you will call your patient, set up another appointment, and then show her the model. And you might do a mock-up for her, which will look bulky, and it might work or not. Or the second way, just to utilize the technology and use the advanced way to convince your patient to go for the treatment and to better communicate between you and your lab and also between you and your patient. So in this case, what we are willing to do, just get for her a simple photo and you can start doing the DSD, the smile design. So what I'm using here, it's Trios DSD, Trios Smile Design. Why I like this one? Because the library, it comes with the Trios software, it's already integrated on on our lab software, so it's easier to detect exactly what's the shape of that teeth which the patient is looking for. So we'll start with the designing, put your template, and you can select the library. You can just show to the patient different library and ask her which one she prefer. And the nice things here now, you can start talk to your patient. You will tell her that according to your gum, this is what we can correct for you. We can add about 2 millimeter and remove 2 millimeter from your gum. This is how it will look like, the shape. So you can utilize the tool which comes from the software and show her how exactly it will look like. Here we are showing our patient the actual length of her teeth and how much we can cut from her gum and how much exactly it will be after gingivectomy. As well, the patient said here she don't want to do the 4 and 5, and again you can show her how it will look like if she will do only the 3 to 3 or if she will do 5 to 5. Then one more, you can just select the shade. This tool only just like a communication between you and your patient, so to know exactly why the patient came to you. So the patient, she already had veneer done before, so why she want to change that veneer? It's better to communicate from day one and get all the information you want from the patient. So it's from the same visit you are getting all this information from the patient, because later on you will send all this information to your technician, to your lab, to start for you the designing. And also as well, you can show your patient how her final will look like approximately. It's not 100%. In the end, this is a 2D photo, it's not a 3D. So just to give an idea to your patient how her final outcome it might look like. And also you can share with your patient her photos before and after, so she can use them at home and check the design, and if she has any other input she can just contact you and send you a message. Now the from first visit we have all this information, plus we have the patient acceptance, your design. Now we are still in visit number 1. It's the day of data collection. Now you start collecting your data after the patient approved. Now you can start collecting your data. So what kind of information we need? As we spoke in our previous video, the integration video, we need three type of information. We need the scan, we need the face scan, and as well the cbct of the patient. So these three information, still in this at the same visit you can get all this information. So start with the scanning, scan the upper jaw, scan as well the lower jaw and the bite. So with all this information you need to send it to your lab, and lab will utilize his software and will copy your 2D to 3D design. So this one comes from you and this one comes from your lab. Now the thing that even between you and your lab, you built up a platform, you built up a design which is comes from you and your patient, and now you can start negotiating with your lab how you can or how we can implement what kind of correction need to be done to the patient original teeth or for her soft or hard tissue to be able to get the design which the patient she select. So done with the conversion, and now your lab can start do the designing for you. Now your lab is utilizing the 3D face scan and as well the CT scan. So he's designing now according to the patient 3D face and according to the patient CT. Now what you'll expect from your lab, they will send you back the design, the 3D design with more detailed and more information. They will give you information about the exactly how much you need to prep, from where I have to prep. So all this information will come from your lab, and as well the gingivectomy. This patient, this case need gingivectomy, so you will get from your lab how much exactly I need to prep, from where, is it all the teeth or only certain or a few numbers of teeth. But 2 millimeter, now it's a time to go deeper with the information. So is 2 millimeter is enough, or do we need to do a hard tissue removal like a crowning thinning? That all depend on biological width. Do I need to call my patient again just to ask her about just to check her biological weight, and how aggressive is that? You need to give her anesthesia and do propping for each tooth. But since you are using the technology and you have the cbct in very easy way, you can integrate your intraoral scan and your cbct, and using the digital tools, using your digital tools and gauge to exactly fabricate a guide, gum guide, and to check exactly how much I need to cut from the gum, and as well to cut or remove from her bone or hard tissue. So here our cbct, it's already integrated with our intraoral scan. And now our technician or our lab can exactly draw for us where I need to cut the gum and how much I have to cut. And then after our approval, so the lab can produce for us the guides We have different type of guide. We have her printed model, so this one can be used later on for as a mock-up. This one for depth guide. These two guides, it's for gingivectomy and crown lengthening. So you give your lab a lot of information, and again the lab will send you back also a lot of guides, guide for the gum, guide for the preparation, a mock-up, and also screenshot for the preparation and for the gingivectomy. So all these things, and still it's in the first visit, all this information only from the first visit. Now the patient, she came again, and this will be her second visit. So she saw all the photos, and again for a second approval from the patient, we showed her the old design which she selected, and also our lab design, and we show her exactly how much we need to cut from the gum, and if we need also to do a crown lengthening. And after the patient approval, we can go ahead and start with veneer removal. So here I'm using the waterless. I believe it's one of the most effective, easiest way to remove a veneer. This video is not accelerated. This is a real-time video, and within few seconds you're able to remove the veneers. The laser technology or the water layers melt the resin under the restorations and can be easily removed by only a simple touch, and your veneer will come out. So it's done. I believe it's how many seconds? It's almost less than 1 minute. Now, since I have already the digital guide which has come from my lab, and also I have the veneer itself, so I know exactly how much the thickness of that veneer, and also I have already the readings which has come from my lab to how much I need to cut exactly from this tooth, so I can decide now if I need to do any more preparation or only minimal preparation. So now the technology helped me to figure out even and save my tooth structure. So done with the veneer removal, now it's the time to do our gingivectomy. I will utilize the guide, the gingivectomy guide. So first of all, try the fit of your guide. Then again with the same laser at the same time, you can start marking your gum. Then you need to go back to your design, make sure how much exactly, just to confirm or double check. Then you remove your guide and go ahead, continue with crown lengthening procedure. At this stage, we already have the information. It's done with the gingivectomy, and we already have the information from our lab that we need to do a slightly crown lengthening. So at the same time, we did the crown lengthening as well. So since we have a model, we can fabricate a mock-up to our patient to show her how almost her final result would look like, And also for the ones who prefer to do a preparation through a mockup, still you can do that option. Either you can use the digital guide or you can do a preparation through mockup. And also you can use your depth guide to double confirm your preparation. So once we are done with the preparation, with the guide, with the gingivectomy, veneer removal, and just I want to highlight again that still we are in the second visit. So the first visit is data collection, second visit is the preparation and the treatment. So now, after we're done, we'll go and start our scanning for the final. And as it shows in the Trio software, you need to scan the lower first, the upper pre-preparation, and this one will be our mock-up. Here the final after preparation, and in the end it's the occlusion or the bite. Starting with lower scan. So again, super fast scan, do the mock-up scan for the upper. See how fast and accurate is that. Now we need to go ahead with the preparation and clear, remove all the mock-up, and then we can mark our teeth and we can start now the scanning of our preparation. So you highlight all the mock-up and trim them all. You can keep for you a reference, so you can use this teeth as a reference to start your scan from. As you can see here how nicely the software stitch both scans together, the pre-op and the post-op. So once it's confirmed, you can just continue with your scanning. Scan all the teeth and then mark the teeth. And here the software will give you an idea if there is any places not scanned and need to rescan again. So you can go ahead and continue again with the scanning. Just to make sure you scanned all the areas. Now, once it's done, it's an optional to use the zoom tool. The zoom will highlight or focus in your margin or any other places, but in our scan, in our case, we'll zoom on the margin area. So we'll give you an order. I will give an order to the software to focus on that margin area. And then you can use also the HD photo, which is really very helpful tool for your lab. Now the lab will receive this scan, but they have an option to remove the color. This is what they are used to. They like to use the stone color, not the colored pink and white scan. So by adding the HD photo, you are adding a very high resolution photo for your preparation, so you will make your lab technician life easier by detecting the margin. So the margin will be really clear for them by utilizing the HD photos. So you can capture photos for your margin area. And here I would like to highlight a point that your scanners cannot detect the margin if there is any kind of bleeding or saliva or it's under the gum. So whatever you can see by your eye, your scanner can detect and scan. So you need to clear your margin, use a proper cord or laser for retraction, no saliva or gum, dry your teeth before the scanning. So now all this information will be sent to your lab, and also you need to get a bite. As you see here, within 11 seconds. So here we are, the HD photo. You can just see how clear is our margin. Also, our lab technician, they can use the HD photo to confirm. And one more thing that we can add it to our scan, we can add the margin. So we can draw the margin to our lab technician. We are the one who prep the teeth, so we are the one who knows exactly where is the margin. So the scanning done. Your lab will receive the scan, the bite, colored scan, uncolored scan, the margin, the HD photo. All this information will be sent to your lab technician. So model needed or not, in some cases your lab technician might need us to print a model. This is a printed model. See how clear the margin, so they can do the final adaptation to your final restoration on that printed models. So the lab will resume with the designing, and then this designing can be sent to the milling machine. And this is a zirconia full monolithic veneers with high translucent zirconia, multicolor, multi-shape. So now the visit number 3. This is the visit number 3. The case done. So within 3 visits, we are able to finish such complicated case and give the patient a nice result without excessive use of material or time or cost. So this is the idea. You need to understand the concept of digital dentistry. What kind of tool you need to use, where to use that tools, how you can implement it, the idea to get the maximum benefit from implementing digital technology in your daily practice. I would like to thank you again, all of you,